Roos test, Adson test, Halsted test, Eden's test, and Wright's test all look for the presence of thoracic outlet syndrome, which is the compression of the neurovascular bundle, or more specifically, the brachial plexus and the subclavian or axillary artery, as it emerges from the neck down across the shoulder. Roos test, a general test for the thoracic outlet syndrome. Can you bring your arms up like this and open and close your hands as fast as you possibly can? Okay, you can relax. We'll continue this test for up to 3 minutes. Our positive sign will be pain in the arm or weakness and drooping in the arm, indicating compression of the neurovascular bundle. It's not specific as to location, so we'll need to move into Adson's, Halsted's, Eden's, or Wright's test following. Adson test. Our first step will be to establish the patient's radial pulse. Then we're going to bring the arm and back past the plane of the body. Can you look up at the ceiling? This has the effect of bringing the anterior scalene muscles back over the neurovascular bundle. Can you turn and look over this shoulder and take a deep breath and hold? If the test is negative, we ask the patient to turn and look toward the other side. Okay, you can relax. Positive sign will be decreased or absent radial pulse, pain or paresthesia radiating into the arm, and it will indicate compression of the neurovascular bundle by the anterior scalene muscle or a cervical rib. Halsted maneuver. I want to establish the patient's radial pulse. I'm going to traction the arm downward and ask, can you look up at the ceiling please, and take a deep breath. The test is negative. Can you turn and look away from me? You can relax. Our positive sign is decreased or absent radial pulse, pain or paresthesia into the arm, which will indicate compression of the neurovascular bundle by the anterior scalene muscle or a cervical rib. Eden's test is testing the next site of entrapment under the clavicle, between the clavicle and first rib. Our first step is to establish the patient's radial pulse. Bring the arm back. Can you pull your shoulders back? Tilt your head forward, please. Take a deep breath and hold. Okay, you can relax. Our positive sign will be decreased or absent radial pulse, pain or paresthesia into the arm. That will indicate compression of the neurovascular bundle between the clavicle and the first rib. Wright's test, we establish the patient's radial pulse. We slowly bring the arm into a hyperabducted state. Our positive sign on this will be decreased or absent radial pulse, pain or paresthesia radiating into the arm. It will indicate compression of the neurovascular bundle between the coracoid process and the pec minor. One small note is that under the coracoid process and pec minor, the subclavian artery changes names to the axillary artery. For Tinel's elbow, we want to locate the groove for the ulnar nerve on the medial surface of the elbow and tap with the end of the reflex hammer. Our positive sign is burning pain sensations down into the distribution of the ulnar nerve, which indicates ulnar neuritis or neuroma. From its paper sign tests the motor integrity of the ulnar nerve. Can you spread your fingers apart like this? And can you pinch and hold the piece of paper? And release. And here. As I try to pull the paper out, she has to use the palmar interossei to abduct the fingers. And one more. Release. And here. The positive sign on the test is inability to hold the paper, which indicates ulnar nerve paralysis. Phelan's test, can you do like this and hold this position for 60 seconds? You can relax. Reproduction of pain into the distribution of the median nerve, the thumb, first finger, second finger, and lateral half of the fourth finger would indicate median nerve entrapment, median nerve neuritis, or carpal tunnel syndrome. Prayer sign. Can you hold your hands like this for 60 seconds? You can relax. Our positive sign again is pain radiating into this finger, here, third finger, lateral half of fourth, would indicate median nerve entrapment, median nerve neuritis, or carpal tunnel syndrome. For Tunnell's wrist sign, we're going to tap between the hypothenar eminence and the thenar eminence. Once again, reproduction of pain into the thumb, first finger, second finger, and lateral half of the fourth finger would indicate median nerve entrapment, median nerve neuritis, or carpal tunnel syndrome.